This is a clean procedure where both eyes may require treatment. Each eye must be treated separately. If infection is present, there should be 2 bottles of medication, one for each eye, to prevent cross-contamination. If only one container, the least affected eye should be treated first to minimize the transfer of infection from eye to another. If more than one medication is being inserted to the eye, time must be given for the first medication to be absorbed before applying further medication. Procedure: identify the patient, explain, check history of allergy, collect and check all equipment, encourage the patient to sit. Remove cap from the container, keep it in clean surface, ensure adequate light source, gently pull down the lower eyelid and ask the patient to look upward. Instill prescribed number of drops into center of lower fornix. Close your eyes and lightly press on the inside corners of your eyes. Carefully blot away any excess liquid that may be in your skin. If additional eye drop ordered, wait for 5 minutes between each medication. Purpose of using eye drops: treat infection, to dilate or contract pupil, to instill medication before examination or surgery to eyes, to relieve pain, itching, discomfort, lubricate eyes, to stain cornea for identifying abrasion and scars.